Hello.
Hello, everybody.
Hello.
Slowly working our way in.
Hello.
Hello.
All right. Well, what time is it? Let's get started because, oh my gosh, it's just so good to see all of your faces. My gosh. And really hoping that we'll get to see some of you live later on this fall. We are thrilled to be able to partner with HEMA Biologics for this call this evening, and our guest speaker, Dr. Guy Young. One of the things that, Eric and I have always felt is very important, from CHESS and from the inhibitor standpoint as people who, have managed inhibitors through our own personal lives, which is kind of, what brought us here to CHESS, is to be certain that you have all options available to you and that you're aware of what treatment options are available to you within the inhibitor space. So we're really excited to be able to bring HEMA Biologics to this meeting this evening for them to share information and for Dr. Young to be able to share information about the newest product on the market. So I would just like Jason Newton, who is the Director of Brand Management for HEMA Biologics, to just say hello. Jason, thank you so much for helping us to sponsor this evening.
No problem. We're extremely excited. This is kind of our maiden voyage with this product. And to be able to do this with Ches and have Dr. Young present the information is we're ecstatic to have this opportunity. So thanks for having us.
Thank you. We're thrilled to have you, thrilled to be here. And every one of these programs that we've done, which has pretty much been every Thursday since March, we award people that fill in the evaluation a $25 gift card. So Eric, would you like to put up our spinny wheel so that we can award gift cards from our last presentation, which was 2 weeks ago, for our Ladybugs program for women with any bleeding disorders. We had Dr. Amber Federizo on our call. It was a fabulous call. So Eric, are we ready?
We are all set. I'm going to spin the wheel 2 times. Here's the first time here. And we're going to go and see who gets the first $25 gift card. And it is Elvira.
Elvira.
She registered for this call specifically. I'm not sure I saw her on the call yet, though.
Not yet, but we have we've had several people who have reached out to say, I can't be here tonight. Would you please send me the recording? Like, absolutely, we can do that.
All right. Congratulations, Elvira. And we're going to do spin number 2, the final one. And our second winner is Sarah.
Awesome.
Congratulations, Sarah.
Awesome.
Get those gift cards out to you as soon as we can.
Excellent. So, Eric, we're good on the housekeeping stuff, right?
We are. I just want to remind everyone that this session is recorded like all of our others here, and we will do a post edit before we send it out to make available for everyone to see, to protect the faces of all of our participants. But just be forewarned, if you want to make absolutely sure that you're not exposed in this video, you are free to just turn your video off. So, but we hope you don't. We like to see your faces.
Absolutely. We love to see faces. Absolutely. So as many of us, or several of us have mentioned, Dr. Young has had an extensive history with the inhibitor community. So he received his medical degree from the State University of New York at Stony Brook School of Medicine in Stony Brook, New York. He completed a residency in pediatrics at Schneider Children's Hospital at Long Island Jewish Medical Center, Albert Einstein College of Medicine in New York, and a fellowship in pediatric hematology oncology at Children's National Center, George Washington University School of Medicine in Washington, D.C. Dr. Young is currently the director of Hemostasis and Thrombosis Center at Children's Hospital Los Angeles and a professor of pediatrics at the University of Southern California's Keck School of Medicine. His current research activities encompass clinical trials in hemophilia, the use of novel anticoagulants in children, and the development of the global hemostasis assays to monitor the effects of medications used to treat bleeding in hemophilia. Dr. Young has published many journal articles, abstract, and textbook chapters, and has delivered lectures, workshops, and presentations at national and international meetings. He is the past co-chair of the Scientific and Standardization Committee on Factor VIII, Factor IX, and rare bleeding disorders of the International Society on Thrombosis and Hemostasis, and also served on the scientific subcommittee on hemostasis for the American Society of Hematology. He's been awarded the National Hemophilia Foundation Physician of the Year Award in 2013. And with that, we thank you very much, Dr. Young, for being here, for providing us with additional information and education.
All right. Well, thank you all for that kind introduction. I definitely saw some familiar names in the on the screen with the people participating. So glad to see those of you that I know. Obviously, won't mention any specific names, but definitely I see some people I recognize. So we're going to talk about a new medication, which was just licensed not too long ago, called SevenFact. This is a coagulation factor 7A, so it's a recombinant activated factor 7 molecule. And so let's jump in and talk about what this is. Now, first, well, you already heard the very detailed introduction. I feel like I look different in almost every picture. I think I remember this one was like a professional shot they wanted in the hospital. They told me not to smile, and I'm not very good at that because I like to smile. So you saw the picture of me smiling before. That's the normal. So it's hard for me to do a picture without smiling. But anyway, that's, I guess, one that was found online. So here's what we're going to talk about, a little bit about what is life like with an inhibitor. And it's, you know, for me to say what it's like, I can only say from a prescriber's perspective. I mean, you all certainly know what it's like in a much more intimate way than me, those of you who either have hemophilia with an inhibitor or have a family member with them. But then we'll talk much more detail about what is SevenFact, how it was studied, the results of the pivotal trial meaning like the one that got the product approved, which is called PERCEPT-1. And then we'll talk about why you might consider SevenFact as an option for you. And then we'll close with some of HEMA Biologic support programs and where you might learn more about SevenFact. So life with inhibitors, I'm going to go pretty quickly through this because most of you can tell me what it's like to either live with an inhibitor or to live with somebody who has an inhibitor. But I'll just go briefly here and say that, so inhibitors, of course, what are these? These are antibodies against either factor VIII or factor IX that develop after being treated with factor VIII or factor IX replacement therapies. And that renders the factor VIII or factor IX no longer effective. And so ultimately, you end up having to use medications that we call collectively bypassing agents. And bypassing agents are basically a way to get from point A to point B without needing the actual factor VIII or factor IX molecule. So they're sort of bypassing that area. And still, inhibitors are considered the most serious complication in hemophilia. It obviously makes life much more difficult. There's a lot more unpredictability, and having inhibitors, of course, the main thing is it makes bleeding episodes more difficult to control, because while the bypassing agents are effective and while they're important to have, they can't completely return the coagulation system to normal. So treating a bleed in somebody without an inhibitor by replacing factor VIII with factor VIII or factor IX with factor IX is always going to work better than using a bypassing agent, which is essentially like a detour. And just like a car detour, a road detour is going to be a less efficient way of getting from point A to point B. The bypassing agent detour is also, less efficient. And so always we try to eliminate inhibitors, when we can. And that's because, bleeding episodes are more difficult to control. And as a result of that, people with inhibitors experience more severe joint disease and disability. And there's lots of papers that have been published comparing patients with and without inhibitors. And it's very clearly evident. What you all know from the lived experience has also been proven through scientific studies that patients with inhibitors are more likely to end up with severe joint disease and disability. And of course, it affects the caregivers as well, because taking care of a child with an inhibitor is significantly more challenging than taking care of a child, without an inhibitor. So it really impacts the whole family. And having bleeds adds an extra level of difficulty to daily life. Clearly, it interrupts the ability to do the routines of daily life, be it work or school or things like that. And bleeding events, they do occur often unpredictably, and they're unavoidable, really, in the process of day-to-day life. You don't have to be super active or traveling. I mean, it's just one of these things that happens on a day-to-day basis. And everything gets put on hold, once you have a bleed and you have to treat a bleed, particularly with inhibitor patients, because it is more challenging to treat the bleeds. It typically takes more time to treat the bleeds, and so it very much interrupts with life. So just that brief background. So back to SevenFact. So you'll see the generic name is coagulation factor 7A recombinant. You see that 4-letter suffix JNCW. So all biologic drugs since about 2017, I think it is, the FDA made a rule that biologic drugs now have to have a 4-letter suffix. So that's what that JNCW is. It is a random selection of 4 letters. It doesn't mean anything. And that's because if, for example, a generic version of SevenFact were to come out, 5 years from now or 8 or whatever, I mean, it's unlikely. But this way, that one could have the same name, except different 4 letters at the end. So that's in case you're wondering what that was. So importantly, we have to talk about the indications and usage. So there's a few slides where I'm going to read things essentially word for word. And that's because I want you to understand it, but also it's something that is really required of me to read when we do these types of presentation. So the indications and usage, SevenFact coagulation factor 7A recombinant JNCW is indicated for the treatment and control of bleeding episodes occurring in adults and adolescents 12 years of age and older with hemophilia A or B with inhibitors. SevenFact is not indicated for the treatment of patients with congenital factor 7 deficiency. And I'll read the warning. This is a boxed warning. It's called thrombosis. So these box warnings are sort of more important warnings than otherwise you see in FDA labels. So the box warning says serious arterial and venous thrombotic events may occur following administration of SevenFact. Discuss the risks and explain the signs and symptoms of thrombotic and thromboembolic events to patients who will receive SevenFact, and monitor patients for signs and symptoms of activation of the coagulation system and for thrombosis. So just to make a few points about this, one is you'll notice that SevenFact is for both Hem A and B patients and only with inhibitors. And at this point, it's 12 and older. So if you're wondering about pediatric patients or less than 12-year-olds, that is likely that the label will expand once there's enough data that the FDA gets to review for the pediatric portion of this. So, but for now, it's only indicated for 12 and up. As far as the boxed warning is concerned, this is not something that is unique to SevenFact. I just want to point that out in case you're wondering, like, oh, that sounds scary. The other bypassing agents, the ones that have been on the market, I won't mention them by name, but you obviously know them. Both of those also have boxed warnings that are very similar to what is written here. So this is not a unique boxed warning regarding thrombosis for SevenFact. It is the same for the other bypassing agents. So I just want to make sure I point that out. So how does SevenFact work? Well, it works quickly at the site of bleeding. So basically, so you can kind of move on with your life. And essentially, 7-Fact, you can see in the figure there, number 1, it basically activates it works through factor 10A and 5A to activate thrombin, which is factor 2, and to basically make fibrin. Fibrin is essentially the material that makes a clot. So 7-Fact activates the parts of the coagulation cascade that lead to this thrombin burst that helps to make a clot. And it works in the absence of needing any factor 8 or factor 9. So you'll notice there's no factor 8 or factor 9 in that figure 1 or 2. It does work through factor 10 and factor 5, which is the normal pathway that follows after factor 8 and factor 9. And so how was it studied? So 7-Fact was evaluated to see whether it was safe and effective for the treatment of mild or moderate bleeding episodes. And successful treatment was deemed to have essentially the following definition. Bleeds have to have a good or excellent patient-assessed response, and I will explain what that means momentarily. Also, patients must have not used any further treatment with 7-Fact or any other hemostatic agent beyond 12 hours, and no increase in pain after 12 hours. So all 3 criteria had to be met to judge a bleed as successful, right? The patient has to say, I had a good or excellent response. I'll show you again what that means in a moment. The patient must not have used additional doses of 7-Fact after 12 hours, and they didn't have an increase in pain after 12 hours. So basically, the primary endpoints were 12 hours for the response and then 24 hours as well to check for pain or for the bleed returning. 27 patients were studied, and a total of 465 bleeding episodes were studied in patients between 12 and 54. So here's defining the satisfactory clinical response. So excellent basically meant full relief of pain. So I'm going to check the chat for a second. I know that you may have some questions, but hello, Dr. Young. I miss I miss you as well. Thank you for that nice comment. So I'll check the chat periodically, although we can just pretty much take questions at the end. So here's the description of the patient evaluation. Excellent means full relief of pain and cessation of objective signs of bleeding, such as swelling, tenderness, and decreased range of motion. So in other words, your bleed was resolved and without additional 7-Fact being used. Good means that the symptoms were better, so largely reduced, but not completely disappeared. So there might still be some pain, there might still be some swelling. And again, but not enough to need more 7-Fact. Moderate really falls more into the category of unsatisfactory. So there was some effect. In other words, things were a little better, but the bleeding did continue and additional doses of 7-Fact were used. And of course, unsatisfactory or no response means that there was no noticeable effect. In other words, the bleed was as bad as it was even after the treatment was 7-Fact. So that's what these definitions are. So let's talk about how the study was conducted. So the study was conducted using 2 IDRs. What does IDR mean? It's just simple. It means, and you see the abbreviation at the bottom, it means initial dose regimen. There are basically 2 dose regimens that we used. A lower dose, 75 micrograms per kilogram as the initial dose, or 225 micrograms per kilogram, which is 3 times the dose of the 75. And then treatment success was determined by a satisfactory clinical response, which we showed you earlier. So satisfactory could be excellent or good, and that all dosing of the medication ceased at that point. And so with the initial dosing regimen of 75 micrograms per kilogram, you'd give the first dose, and then you could give additional doses every 3 hours up to 24 hours. Beyond 24 hours, you couldn't give additional doses. If you were still bleeding beyond 24 hours, it was considered a failure, and then you could use another medication. So you can give doses every 3 hours until you felt like you were better. So you could give 1 dose, 2, 3, or more. And the response was determined by how many doses were needed to get to the satisfactory clinical response. And again, satisfactory means excellent or good outcome based on the patient assessment, no further 7-Fact or blood products through 24 hours, no other hemostatic agents, and no increase in pain. All right, so you could have, your pain could be stable, but it can't increase. You have to meet all 4 of those to be judged as a satisfactory response. Now, for the other dosing regimen, so the other IDR, initial dose regimen, the initial dose of 225 micrograms per kilogram, if you were giving that dose, then you could not give anything else for 9 hours. So you had to wait 9 hours to give any additional doses. And then at 9 hours, if you felt like your bleed wasn't resolved, you could give another dose, but that dose, notice, is 75 micrograms per kilogram. So only the first dose can be 225 micrograms per kilogram. Then subsequently, all the additional doses would be 75. Now, you didn't have to give additional doses. You could decide at 9 hours, hey, I'm doing fine, my bleed's resolved, and you didn't have to give any more. Or you could give one more at 9 hours, or you can give an additional one 3 hours later, and so on. So the difference between the two arms really is the first dose was a third of the dose. The 75 dose was 1/3 the dose of the 225. And if you gave the 225, you were not allowed to give any more doses of anything until the 9-hour assessment point. So in the study, there were many different types of bleeds. Obviously, joint bleeds was the most common, and joint bleeds in the places you expect, knee, elbow, ankle, most common, but there were also bleeds in other joints as you see listed there. And soft tissue bleeds as well, nose or mouth or muscle could also be treated. So any bleed really that required some form of treatment could qualify as a bleed that needed treatment with SevenFact on the study. And essentially, a main outcome, and you'll see this number repeated, is that 84% of the bleeds were able to be treated with just one dose of 225 micrograms per kilogram. In other words, and I'll show you this again, but the patients who were on the 225 microgram per kilogram dose, 84% of them did not need to give any additional doses and felt that their bleed resolved with just that one dose. And we'll come back to that. So let's get into a little more detail about the initial dosing regimens. Again, this refers to, and this IDR is a distinguishing feature between the SevenFact dosing schedules that are recommended for treating bleeding episodes that were mild or moderate. Severe bleeding episodes, I'll show you one slide later, is really more, that was using only the high dose regimen. So if you felt you had a mild or moderate bleed, so the typical kind of joint or muscle bleed or otherwise, then there were these two initial dosing regimens that were used in the study. And there was only the one dosing regimen, as I mentioned, the higher dose for severe bleeding episodes. So let's look at the results. So for those who were on the 75 microgram per kilogram IDR, initial dose regimen, at 3 hours, single dose efficacy. So at 3 hours, 29% of the patients, so about a quarter, felt that their bleed had resolved. Now, typically, we don't think of bleeds resolving that quickly. So I view this as a positive in the sense that even at this somewhat lower dose, that about a quarter to a third of the patients, somewhere between a quarter and a third, felt that the one dose was enough to control their bleeding. If we take it out to 12 hours, now we're up to 82%. And you see there's 252, the N equals 252 means 252 bleeding episodes were treated with this initial dosing regimen, 75 micrograms per kilogram. So obviously, the vast majority of bleeds needed more than just the one dose and needed additional doses at 6 hours, 9 hours. But once you got to 12 hours, 82% of the patients reported that their bleeds had resolved satisfactorily at that point, meaning that they got 3 doses of the 75 micrograms per kilogram. If we take it out to 24 hours, you'll see in the sub-bullet there, almost 97% of the bleeds were resolved at 24 hours, even with many of those requiring additional doses. And successful pain relief at 12 hours was reported by the majority of the patients in both the IDRs, both the 75 and the 225. So let's look at the 225. So in this case, the single dose efficacy was measured at the 9-hour time point, not the 3-hour time point. Obviously, for the 75, you're going to give another dose at 3 hours if you're not happy. So that's why the time point had to be different. And in this case, you see 84% were satisfied that by 9 hours, their bleed had resolved. And by 12 hours, that went up to 91%. So clearly, the 225 dosing regimen allows for a single dose to result in a good response or an excellent response in the majority of the patients, in 84% of the patients. And in fact, in this reporting scheme, so patients got to fill in the reports every 3 hours. And if you look at the bottom there, that 84% of the bleeding episodes were felt to be resolved by 3 hours. And the same 84% were resolved at 9 hours. Once we get to 12 hours, you see on the scale on the top, it's 91%. And by 24 hours, it's practically 100% had resolved at this dosing regimen. So what kind of patients were treated? So this is the disease stated screening of the 27 patients. You see most had hemophilia A, which is not surprising because inhibitors are much more common in hemophilia A, which is a more common illness as well. 2 of the patients had moderate hemophilia because it is possible to get an inhibitor with moderate or even with mild hemophilia, but the majority of patients with inhibitors have severe hemophilia at their baseline. The baseline factor level you can see is well less than 1. And in the inhibitor status, when patients were started on the study, is that about half had a high Bethesda titer of greater than 5. So they had a high titer inhibitor at the time that they were enrolled. About 40% had a titer less than 5, but historically, they have a high titer inhibitor. So that means the anamnestic response means that even though at that moment you're less than 5, if you get any factor VIII, it boosts way up above 5. So really, those 25, which is obviously the majority there, have essentially what we call a high titer inhibitor. And then 2 had a low titer inhibitor, less than 5 Bethesda units, but they were refractory to increased factor dosing. So even though maybe their inhibitor titer didn't go up that high, giving factor didn't resolve their bleeds. So the bottom line is the 27 patients all had to have a form of inhibitors that precluded them from using factor VIII for treatment. So let's take a look at the resolution at 24 hours, just in a slightly different way. We already reviewed this, but here's in a chart where you see at 24 hours in the 225 microgram per kilogram IDR, it's almost 100%, 99.5%. And with the 75, it's 96.7%. This is really not, it looks a little different, right? 3% difference, but it's really not a statistical difference. Both obviously at 24 hours, the overwhelming majority of bleeds resolve by 24 hours. So I don't want you to take away from this that the 75 is not as good as the 225. This very slight difference is probably not, it's not statistically per se meaningful. Only one patient, or I shouldn't say one patient, only one bleed rebled. So out of the 465 bleeds total, one person had a rebleed, or one of those bleeds rebled. So that's a very, very low rebleeding rate because we know that rebleeding is common. So beyond 24 hours, beyond this near 100% bleed resolution for both of these, only one patient rebled beyond the 24 hours. So rebled meaning bled in the same joint afterwards. So let's look at the severe bleeding episodes. So there are only 3, so we can't read too much into this with just 3 bleeding episodes. First of all, what were the severe bleeding episodes? There was a traumatic intramuscular bleed. There was a spontaneous renal hemorrhage, meaning bleed in the kidney, and there was a spontaneous hip bleed, all felt to be more severe. So if the patient felt the bleed was severe, they had to treat with a higher dose of 225 micrograms per kilogram as the initial dose. And then you can see they were allowed additional doses as early as 6 hours later. So this is different than the mild to moderate bleed. And they could dose every 2 hours as needed until there was improvement. So let's take a look at what happened with these 3 severe bleeds. The traumatic intramuscular bleed was treated with just one single dose of SevenFact, and the bleed was felt to be resolved. The kidney bleed, the renal hemorrhage, in the second patient had 5 doses. Of course, 1 of the large doses, and then 4 of the smaller doses. The follow-up doses are always smaller. So that person gave 4 additional doses. And for the spontaneous hip bleed, there was, of course, the 1 large dose, and then SevenFact was given at 0, 6, and 12 hours, which is not exactly how it's supposed to happen. You can see in the little diagram at the top, additional doses were supposed to be every 2 hours, but in this case, they were dosed at 0, 6, and 12 hours. So we call that a protocol deviation. It deviates from what was supposed to occur in the trial. But be that as it may, those things happen. So the bottom line is all the severe bleeding episodes achieved hemostasis at 12 hours and did not require additional treatment. So the second one, notice the 4 doses would be at 6, 8, 10, and 12 hours. So for all the severe bleeds, no additional treatment was needed beyond 12 hours and no retreatment was needed. So the point here is that while there's a very small number of these more severe bleeds, that SevenFact was effective and was effective within 12 hours, either with 1 dose or with several additional doses. So let's review the safety information, because this is very important as well. So I think I've shown you that SevenFact works. So let's talk now about safety. So what is the most important information that you should know about SevenFact? So again, this is something that I really should read to you, basically word for word. So the most serious possible side effect of SevenFact is abnormal clotting involving blockage of blood vessels, which includes stroke, blockage of the main blood vessel to the lung, and deep vein clot. So we're talking about here stroke, pulmonary embolism, or a deep vein thrombosis. So serious thrombotic events are possible. And as I said, this is not unique to SevenFact as a bypassing agent. The other 2 bypassing agents have the same safety information. So importantly, you should know the signs of abnormal clotting and seek medical help immediately if they occur. So when your doctor prescribes these medications to you, they should explain to you what the symptoms would be if you have abnormal blood clotting. So just briefly here, signs of clotting in places other than your site of bleeding can include new onset of swelling and pain in the limbs, new onset of chest pain, shortness of breath, or loss of sensation of motor power or altered consciousness or speech. Basically, that first one, swelling in the pain or pain in the limbs, would be a deep vein thrombosis. Chest pain, shortness of breath would be a pulmonary embolism, and loss of sensation or motor power or altered consciousness or speech would be signs of a stroke. So please be aware of those. Now, what is SevenFact? SevenFact is, and I'll just read this as well. I mean, we've gone over it already, but it's an injectable medication used for the treatment and control of bleeding episodes occurring in adults and adolescents 12 years of age and older with hemophilia A or B with inhibitors. Injecting medicines requires special training. Do not attempt to self-infuse unless you've been taught how to by your healthcare provider. And who should not use SevenFact, coagulation factor 7A, this brand of factor 7A? You should not use SevenFact if you are allergic to rabbits. I'll explain why in a second. That's pretty specific. You should not use SevenFact if you're allergic to rabbits, or if you have known allergies to SevenFact or any of its components. Seek immediate medical help if you experience hives, itching, rash, difficulty breathing with cough or wheezing, swelling around the mouth and throat, tightness of the chest, dizziness or fainting, or low blood pressure after taking SevenFact. Tell your healthcare provider to use SevenFact tell your healthcare provider prior to using SevenFact if you've begun treatment of a bleeding episode with another bypassing agent. So let's break that down a little bit. Why rabbits? So SevenFact is made in an unusual way. Essentially, rabbits are given the genetic code for making this factor 7A, and they express it actually in their milk. So yes, if you've never thought about what it must be like to milk a rabbit, this may be the time to start thinking about that. But essentially, the rabbits will produce this factor 7A based on what's something called transgenic technology. So you're putting the gene for human factor 7A into the rabbits. The rabbits make a lot of factor 7A. It's expressed in their milk, and then from the milk, it's purified. We'll show you the purification in a moment. So that's why if you're allergic to rabbits, in theory, at least in theory, you may have an allergic reaction to SevenFact. Having said that, I've actually never met somebody allergic to rabbits, but I'm sure that it happens, so keep that in mind. The second part there about the itching and rash and hives, that's basically the signs of an allergic reaction. So if you have the signs of an allergic reaction, obviously get medical help right away. And then if you're using another bypassing agent, and as I mentioned, there are 2 others on the market that you're familiar with, definitely let your healthcare provider know that, hey, I'm already treating with this one, so can I also use SevenFact? And you should have that discussion with them. More important safety information. What should I tell my healthcare provider before I use SevenFact? Tell your healthcare provider if you are pregnant, are nursing, or plan to become pregnant. If you've had prior blood clots, heart disease or heart failure, abnormal heart rhythms, prior pulmonary clots or heart surgery, or if you have or have had any other medical conditions. So, this is all about safety. Obviously, this has not been tested in pregnant women or nursing women. Of course, we know that hemophilia in women is less, certainly severe hemophilia and inhibitors is far less common in women because the genes for hemophilia are on the X chromosome. So we know that it's unlikely that anybody's going to come across that situation, but it's always important to mention that because SevenFact has not been tested in pregnant women or nursing women. If you have had a prior history of blood clots or heart disease, we want to make sure that it's safe for you to use SevenFact, so you should let your doctor know, or any other medical conditions. Obviously, your doctor should know what medical conditions you have. Possible side effects, again, the most common adverse reactions to SevenFact are reported in the trials are headache, dizziness, infusion site discomfort, infusion site hematoma, and infusion-related reaction and fever. So these are the things that were reported in the clinical trials. Obviously, some of these things can occur. They're not necessarily serious. Many of you have had, or if you're treating a significant other or child, reactions at the infusion site, such as a hematoma or a bruise or discomfort, are not uncommon when you're infusing medications. And then obviously seek immediate medical help if you have signs of a blood clot or an allergic reaction. And then, if any of this happens, we want you to report these suspected adverse reactions. And there's information there for you on how to do that, either through HEMA Biologics or through the FDA, which has a system called MedWatch. And this is important because you've heard about the Johnson & Johnson vaccine, which was held up for a little bit because of some adverse reactions. Well, those were reported to the FDA. And once they're, one from one part of the country, one from another part of the country, once these get collected, then you can see a pattern. And that's why the FDA has this reporting system there for you. So that's how those were picked up. And just to say that, those are so rare that the FDA has decided that it is safe to continue giving the Johnson & Johnson vaccine. I don't want anybody to walk away here thinking that it's like off the market or anything. But I was using that as an example of how reporting suspected adverse reactions to FDA can have important outcomes. So let's talk about how SevenFact is manufactured. I mentioned earlier that it's produced in rabbits, and basically the milk of the rabbits is collected, and then it goes through a lot of purification, getting the factor 7A, first of all, out of the milk, and then it goes through significant steps of viral inactivation, so eliminating viruses that could possibly be in this recombinant solution, and then other steps that I won't get into the complications of what these mean, affinity gel chromatography, affinity eluate, and purification steps. The bottom line is it undergoes many purification steps so that by the end, what you're left with is a very purified factor 7A product without anything else from the rabbits or from the milk of the rabbits. So a little bit more about the safety profile. So we already went through the other adverse effects. You can see that there were a total of 42 of these adverse effects, mostly related to the infusion, right? You see 4 infusion site discomfort and infusion site bruising and infusion-related reactions. So not unusual with IV drugs. The rest of those are obviously very few patients and nothing that is particularly concerning, dizziness, headache, things like that. So in the SevenFact clinical trial, I think the important thing is that there were no inhibitors formed against SevenFact. There were no allergic reactions. Not to say that it can't ever happen, but there were no allergic reactions, and there were no thromboembolic events. So, and the adverse events that you see listed were the same regardless of the dosing regimen. So if you were on the higher IDR, lower IDR, the number of essentially adverse reactions or side effects are similar. So again, I'm not going to read the bottom part. I already read that verbatim, I think twice, but it's just listed there on the slide about the important information that you should know about SevenFact and the signs and symptoms of blood clotting. And as I said, I already read those, so I'm not going to repeat it. Don't want to take too much time out of that. So a couple other points, and then we'll get to some Q&A. Convenient to store and convenient to use. So SevenFact can be infused quickly. If you find your vein quick, in 2 minutes or less, you can push the plunger and infuse it. If you happen to have reconstituted it, you can keep it for up to 4 hours after reconstitution and then still use it. Beyond 4 hours, no, you shouldn't, because it can start to decay and not work. As far as storage, it doesn't have to be refrigerated. You can see that it can be stored basically at any temperature from 2 degrees Celsius or 36 degrees, which is refrigerated temperature, or up to 86 degrees. If you're in a really hot place, then find a cool place in your home, or if you do live in a very hot place, then you probably should put it in the refrigerator. And after reconstitution, it needs to be kept as well at room temperature for up to 4 hours. Obviously, 7-Fact, just like other products, shouldn't be frozen. Probably the vials will break anyway. And of course, just like other products, there's a kit. So you'll have a kit that includes mixing system, a pre-filled reconstitution syringe, a vial adapter, all those things, and instructions for use. And the pharmacy can provide infusion syringe and supplies. And 7-Fact comes in 2 different sizes: 1 milligram, which is in a yellow labeled cap and yellow syringe, or a yellow bar in the syringe, and 5 milligrams. So you'll have to, based on the dosing for you and your weight, you'll have to figure out the best dosing for you. And you might have to mix vials. Obviously, you don't mix them in the same syringe, but you may have to put different syringes on. If, for example, your dose is 7 milligrams, then obviously you use a 5 and 2 ones. So what reasons for you to consider 7-Fact? Well, it works quickly. We showed in the 225 microgram per kilogram dose that a single dose had an 84% effectiveness for mild to moderate bleeding episodes at 3 hours. So within 3 hours, you can have a really good response, so rapid action. If we go across to the right, the single dose efficacy, so 1 dose alone was effective. It's strange that it's the same number, but that's how it worked out. 84% was effective with just 1 dose at 9 hours. So you've got a high, it works quickly, and it can work for many, many bleeds with 1 single dose. If we look at the efficacy overall, at 12 hours, a little bit higher for the higher dose, the 225, which is not surprising. But by 24 hours, you see that they're quite similar, and you have overall a very high efficacy rate, approaching 100%, or between 95 and 100% for the 2 dosing regimens. As far as safety, the serious things we worry about, thrombotic events, antibodies, and treatment-related severe adverse events, none of those were seen in the trials. And it's convenient for home use because 98% of the bleeding episodes in the trial were treated at home, and it is room temperature stable, so you can store it at room temperature for quite a long period of time, as long as your room is not more than 86 degrees. MASAC, which is the Medical and Scientific Advisory Council of the National Hemophilia Foundation, just put out a recommendation or statement basically saying that using 7-Fact for the treatment of breakthrough bleeding episodes in patients who are using Hemlibra is certainly a very reasonable thing to do. And finally, last few slides, could 7-Fact be an option for you? Well, obviously, every kind of treatment decision should be between you and your healthcare provider. And you all know the best that decisions are made when you and your trusted healthcare provider can make decisions together. And if you're interested in 7-Fact, then obviously talk to your healthcare provider about it and see, could this be a treatment option for me? Are you older than 12? Do you have HEMA A or B, and do you have an inhibitor? Well, in that case, it potentially could be a treatment options for you. What question do you need to think about before your next appointment? Well, how long does it take for you to get a bleed under control? Is it taking 6, 9, 12 hours? Well, 7-Fact has been shown to work quickly within 3 hours. How many doses does it take? Are you typically using 3, 4, 5 doses to treat a bleed? Well, with 7-Fact, with the higher dose, we saw that 84% of the bleeding episodes could be treated with just 1 dose. And how often is your life interrupted to infuse? So those are the questions you might think about when you approach your healthcare provider, or think about before you go to your healthcare provider. And then, of course, asking your healthcare provider, would 7-Fact be an option for you? If it is an option, is the higher dose appropriate for you? And how would 7-Fact fit into the current treatment regimen overall that you're using for managing your bleeds and potentially preventing your bleeds for those of you who are on Hemlibra? So all those questions should come into mind. And then so that's pretty much the end of the main part of the talk. Just a couple things here. There are patient support programs. I want to save time for questions. I'm not going to read each and every one of these. Obviously, this talk is being recorded. These slides can be made available to you. But you can see there's a copay assistance, copay savings program, a patient assistance program, quick start program, bridging program, a benefit investigation coverage determination program, and prior authorization support. So obviously there's a lot of supports there to help you to get on SevenFact if it's something that you and your healthcare provider determine might be a good option for you. And then there's some resources there, sevenfact.com. You can find a lot of resources there on the website. There's a phone number as well. So plenty of support for you. And then, yeah, here's just a few other resources, basically the same ones that were on the previous slide, plus an email as well. And so with that, I will stop. And I think we've got about 10 minutes or so for questions. I know it's getting a bit late for those of you on the East Coast, but we'll stop and take a look and see if you guys have some questions. So thank you.
Well, thank you, Dr. Young. It looks like we had a few questions in the chat boxes. You addressed a few already, that it can be used in combination with the use of Hemlibra per MASAC's recommendations.
I can kind of run through them maybe in order, so I can see them as well. Maybe it'll save some time.
Yeah, go right ahead.
So it says, can you speak about using SevenFact with Hemlibra for breakthrough bleeding? So I did speak about that, and yes, the answer is you can. So I think that's pretty easy. The shelf life, well, just like all factor products, it initially, I believe they have a shelf life that is out maybe to as much as 2 years, but whatever product you get at home, you'll have to check the expiration date. But typically, if you get long dated product, it should be good for many months, up to a year. Can SevenFact be used for prophylaxis? So the answer to that is no. It has not been studied for prophylaxis, and therefore it is not appropriate to be used for prophylaxis. Hemlibra, another Hemlibra question, which we answered. Does the shelf life vary if it is kept at room temperature versus in the fridge? That's a really good question, and I actually don't know the answer to that. I'll have to ask one of the HEMA Biologics people on to see if they have an answer. Typically, shelf life will be longer in the fridge, but for this product specifically, it's a really good question, and I apologize, I don't have the answer. If one of the HEMA people wants to jump on and answer that question, please do. If not, if you can get back to answer it. It was answered. No need to refrigerate as long as it's stored in the range. Got it. SevenFact is up to 3-year dating to expiry. So I said 2 years, and it's actually 3 years. Yeah, the big question, right? I was waiting for this one. How does SevenFact differ from Novo7? Is it a generic of Novo7? So it is not a generic of Novo7. Let's start with that. It is a different version of factor 7A. One way to think about it is that it's sort of different in the way that the different factor VIII products are different, right? So, I won't mention specific brands, but brand A of a factor VIII concentrate and brand B and brand C, they are different. There always are some differences. But the question is, how does SevenFact differ from Novo7? So it differs partly in the way that it's produced. As I mentioned, it's produced in transgenic rabbits, whereas Novo7 is made more in a fermenter, a big, essentially like a big, huge vat. One of the ways, and this gets a bit esoteric, but in the studies, what was shown early on is that SevenFact binds to something called endothelial protein C receptor. It's essentially another part of the coagulation system that is aimed at actually preventing overexuberant clots from forming. But it also localizes factor 7A to the site of bleeding. So it's a subtle difference, this binding to what we call EPCR. Now, whether that difference impacts on its effectiveness or not is not really known. So, but there may be something to that, but that needs more study. I think a really important difference, as you saw, is the dosing. So factor 7A in the United States is licensed at doses of 90 to 120 micrograms per kilogram. I realize some of you may have used different doses, but the prescribing information only is for 90 to 120 micrograms per kilogram given every 2 to 3 hours. SevenFact has both of these dosings in the label, the lower IDR of 75 micrograms per kilogram and the higher of 225. So the dosing is different per the body weight. That's another way that they are different. So there are some differences in the dosing, possibly some differences in the way that it binds to the area of bleeding. And then, from the clinical trials, you can't really compare across clinical trials. I'll just suffice it to say that clearly, SevenFact has, very good efficacy. I mean, Novo7, has good efficacy too. Not here to bash on Novo7. We've been using it for 20 years. But SevenFact offers, an alternative to Novo7 that may offer, for example, a single dose, which is in the prescribing information, which is not in the prescribing information, for example, for Novo7. What is the percent of people with inhibitors to factor VIII that can take factor VIII successfully through prophylaxis? So patients with factor VIII who have inhibitors, there is a category that have a low titer inhibitor. So they have a very low level of the inhibitor. And at the same time, when you give factor VIII, the inhibitor doesn't go up further. So it doesn't go up higher. And for those patients, if you use more factor VIII than for patients without inhibitors, you potentially can overwhelm the inhibitor. So I have some patients, for example, who are using a quite high dose of factor VIII every other day, much higher than they would typically use, but that works for them. And they prefer that over the other options that they have. But that's a small percentage of the inhibitor patients that have what are called low titer inhibitors. It's probably less than 10% of the inhibitor patients that can actually use factor VIII successfully through prophylaxis. And that's a good question to ask if you're asking specifically for your provider. Just to clarify, 225 is not recommended for use with Hemlibra. I don't know if that's correct. I don't think there's anything specific. There's nothing specific in the prescribing information that I'm aware of that says that, the low dose or the high dose is what's recommended with Hemlibra. Just remember that with the low dose, most of the patients some patients only got one dose, but as you saw from the efficacy, most of the patients ended up getting 3 doses of the low dose. So at the end of the day, to treat the bleed at the 12-hour mark, most of the patients got basically the same total dose or a similar total dose. It's not like a lot of patients got the 75. So I don't believe that the initial dosing regimen of 225, and that should be micrograms, not milligrams, and micrograms per kilogram. I think that can be used. My understanding is there's no reason why that can't be used with Hemlibra. If I'm wrong about that, I need a HEMA Biologic person to come on, but I don't believe that it's stated in any way in the prescribing information that you can't use a higher dose with Hemlibra.
Yep. Dr. Young, you are correct. It is not contraindicated. You are correct.
Thank you. Thank you for clarifying. Well, we're right at the top of the hour, so I will, doesn't look like there's more questions. I'll pass it back to our hosts. Thank you.
All right. Thank you, Dr. Young. Do we have any other questions? This is your chance. Great questions, everybody. And thank you so much for both Dr. Young and HEMA Bio. Oh, we do have. What is the cost comparison for SevenFact versus the other bypassing agents on the market currently?
Yeah, that's a question for HEMA Biologics if they want to take that on in this session. I actually don't know the answer.
Yep, I'm happy to answer that, Dr. Young. This is Jason Noon from HEMA Biologics. So it depends on what you're kind of saying cost. If you're talking about the wholesaler acquisition cost of the 2 products, SevenFact is actually cheaper than Novo7. But when it comes to what a patient would actually pay, that would depend on your, insurance coverage and, where it falls on different tiers and such. I will put a plug in. HEMA Biologics has provided support services and financial support that is 100% on par with our competitors. So knock on wood, probably at the end of the day, you would see no difference in out-of-pocket costs associated with what you would be paying as a patient.
Excellent. Thank you. All right. Well, just to let you know, again, thank you very much. Such a great turnout, lots of great questions. Really happy to see a lot of familiar faces and new faces, and look forward to seeing you for other webinars. Next week, we have an Eating Yourself Healthy presentation. One of the questions that we get frequently in our evaluations when we ask, what topics are you looking for? Nutrition and healthy eating has always been kind of in the top 5, and as we all know, food is fuel, and the better nutrition you have, the better the health outcome. So please, we look forward to seeing you next week with Tina Willis, who is the dietitian at the Indianapolis Hemophilia Treatment Center. The following week, May 20th, if anybody on this call also has von Willebrand's disease, because we have definitely seen those comorbidities, we will have Dr. Jonathan Roberts from the Bleeding and Clotting Disorder Institute in Peoria, Illinois, to talk about the latest VWD guidelines and study updates. And then another topic that is always asked for, and in light of continued COVID indications, we will do mental health with Annabelle. She's one of our favorite presenters on mental health. We will have a session with her. So please join us. No question is a bad question. And we look forward to seeing you there. And then the following week, we will have gene therapy presented by BioMarin. So we look forward to, if you're looking for information, I know right now gene therapy isn't available for patients with inhibitors at this time, but let's hope that eventually, that will change. And then our last webinar for the spring will be on advocacy. How do you get what you need? And that will be on June 17th, presented by 2 fabulous patient advocates, Connie Montgomery and Barb Force. And Savannah, yes, I do have, we can definitely do that. Just so you know, if you go to our website and look at all the presentations that we have had since March, if you're looking for a recording, please don't hesitate to reach out to us, and we can certainly send you that recording, right, Eric?
Yeah, that is correct. Here, I'm going to put the link in here to the webpage. It's actually through the nSpiration Foundation website where all these the agenda is posted. So there's the link right there you can click on. As Janet just said, just let us know if any of those interest you, and we'll be happy to send you the links to view any of those sessions.
Absolutely. We've had some great sessions this spring. Just a reminder, you will receive an evaluation probably tonight, right, Eric?
Yeah. Well, I just sent that in the chat box too. You can access it through the chat with the link there, or you can receive it via email. We'll send it to you with the email that you provided. And there's a few people who actually called in on their phones. I cannot send it to you via chat that way. So if you'd like that, just reach out to us and we can send it to you. But you should get it through your email. And just a reminder, if you do fill out an evaluation, that does put you up to get your name on the wheel for the next session, just get the wheel spin to maybe win a $25 gift card. And you do not have to be present. Of course, we'd like to see you there, but you don't have to be present to win it. So
awesome. All right. So anything else? Did we cover all the housekeeping stuff?
I believe so. I just want to say thank you so much for everyone for joining us and letting us spend a little bit of time with you. It's really great to see you guys' faces. We miss you so much. So we look forward to seeing you hopefully live and give you some hugs and whatnot soon. So
Absolutely.
Eric, can I say one last thing, please?
please,
Please.
Jason, go ahead.
Just wanting to thank you all first and foremost to give HEMA Biologics this opportunity to connect with the community. It's a crazy time with the pandemic, so this opportunity is fantastic. Would like to thank Dr. Young for his time and energy and taking a lot of information in that deck and bringing it to life. And one last plug, if this information was impactful to you, if you want to know more about SevenFact, if you want to talk to somebody at HEMA Biologics, if you will go to SevenFact.com, there is a dialog box that pops up when you go to the website, and you can put your name, email, telephone number, and we can reach out to you if you'd like to have further information.
Thank you, Jason. And really, we truly appreciate being able to partner together. It just is always nice to know that there's another tool in the toolbox for those of us with inhibitors that, you know, we're very often searching for answers, especially for the hemophilia B population and for, you know, many of our patients that, you know, are still experiencing breakthrough bleeding. It's good to know that there's something else. It's funny at HFA, back when we could do live events at the inhibitor track, I remember a conversation about, you know, do we think that, you know, the latest product is it? And unanimously, the entire room said, no, that's not all we're looking for. We're looking for more. So we really appreciate the opportunity to be able to provide more. Choices are good. So thank you, everyone. Did I miss another question? No. All right. It has been a pleasure. We hope we see some of your faces next week. Thank you again, Dr. Young, as always, for providing us with information. Thank you again to HEMA Bio. And I hope everyone has a great night. Take good care.
Everybody.